It's not about me. It's about other people and what I can bring to them and how I can make their lives better, how I can make my community better. I was elated when I found out I was going to receive the primary care physician scholarship. I just feel like I'm very blessed, you know, to be going through medical school without having to have this big looming cloud of debt over me. This was something that was very important for me. And I think it's another obstacle, just another obstacle for people who want to pursue medicine. And I think this really opens up the opportunity for those people to see, hey, you know, I can actually do medicine. I don't have to have this huge amount of debt that I'm gonna have to pay off, and I can do something that I really love. The commitment for the scholarship means to me doing what I want to do. It really matches up with my goal and my mission as a doctor, as a physician, to come back and serve the people of Yuma here. What was it like growing up in Yuma? Oh man, a lot of people, when they think of Yuma, you know, either if they're from Phoenix or Tucson, they say, you know, we just drive through there, you know, it's an empty town. And it's not. You know, we have about 100,000 residents here, and more or less, I think everybody kind of knows each other. Yuma is wonderful, and it's definitely a place that when I have a family, I would love to raise my kids. When I first really noticed the sort of scarcity of care here, the doctor shortage and the implications, was when it really happened to me. I mean, I've heard stories before from family and friends, you know, about wait times and things like this. But it's really when I had my car accident back in October of 2019. The physician said, you know, you have 2 broken metacarpals. Right now, I don't think you need a surgery, but I would follow up with an orthopedic surgeon. There was only one physician and one orthopedic surgeon who did hands. It took me about an hour and 45 minutes to be seen. And when I go in, he says to me, your hand needs a surgery, but we're all booked up until February. All of a sudden, my mindset changed. I said, you know what? There's a need here. And from that point, everything just changed. I never looked back.
Samuel was working at Dr. Garcia's office, and so he sends a text, Mom, I am accepted to the University of Arizona. And we just hugged. And so I sent a text to all my sisters because they were all in the loop, and they were praying, right, that Samuel would get admitted. And their response was just great as well. It's not just a, you know, one family endeavor. It's I get emotional. It's an extended family endeavor.
Seeing how he's growing and he's already making an impact, I feel very proud of that, and very blessed that my son Samuel had this opportunity.
I feel like being a primary care physician in a place like Yuma versus somewhere like Los Angeles or New York there's a more limited supply of you. In Yuma, I feel like you know more of the city, you know more people, and you're following up with your patients who are living here throughout the span of their lives. And it's also a generational thing, you know? Your parents might have gone to this physician, so you're going to this physician too. And I think that's a more beautiful thing as a provider.